Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Well, hello everybody and welcome to this next Soul and Survival podcast, and welcome to you, Louise.
Thanks, Grant. How you going?
Okay, tell me, what have we got on?
What are we talking about? We're just going to have a little digression from cases, but we'll get back to that. There was a question came through this week to the clinic from another homeopath who does work with HFA, and her query was, what do you do with patients who are using multiple disciplines at the same time as using homeopathy? And she even mentioned that she knew of other homeopaths who would refuse to take on a case if the patient was going to use different modalities at the same time. And it generated a discussion between us, and we even put together a response. So I think it's a really interesting question and a topic that we certainly see all the time. It's very rare that someone only chooses to use homeopathy. Not completely rare, but it's relatively rare. But we can still work really effectively with homeopathy, even when the patient chooses to use other treatments, lots of different treatments. So, yeah, your thoughts on that, because you had a lot of good things to say, I thought.
Well, I don't remember what I said, but because it was about 15 hours ago now, but so I don't remember exactly what I said, but I don't. I still treat anybody that comes my way, no matter how much medication or what other therapies that they're using. I'm not one of these ones like she was saying in that email that, you know, she knows other practitioners that will just simply refuse to practice if somebody else, if there is another modality that's involved, and you've got to get off meds, some people say, and all this kind of stuff. I've never done any of that kind of stuff because, again, I think I've said this once before, I think that if you have to be a Puritan about the circumstances before you even treat a patient, meaning that they can't do the toothpaste, they can't do the coffee, they can't do steroids, they can't do antibiotics, they can't do herbs, they can't do this, they can't do that, otherwise I won't treat you. One, I think that that's a little precious, and also, two, I think it's unrealistic because most of my patients are American patients. They're American mums that are worried about their kids. So why that's important in this context is because by the time that they're willing to see an alternative therapist in another country, they've tried a lot. They've tried everything. And a lot of the cases, some of these things can be working, but they won't be working at a particularly deep level. Otherwise, they wouldn't be patients of mine. They wouldn't have booked in. So I'm going to assume that some of these things are doing a peripheral job. And they also, too, they want to keep under the care of whatever doctor that they're used to going to, for a couple of reasons. One, I think because they want open communication lines, with somebody that they can see and in person, and also that is contactable. Now, that doesn't mean that we are not contactable. We're actually have a very open door policy, but it's all done via email. It's not like you can just ring me up, or you can't just book an appointment to see me tomorrow morning or anything like that. We're booked up months and ahead. So, but I do answer emails if it's necessary. I don't encourage it if it's not necessary. I'm not looking for extra work, that's for sure. But if there is a genuine problem, we've always been very open right from the beginning of making sure that we are contactable. So by the time somebody comes onto my patient list, then they're usually on a whole range of things already. So what I ask is, when I get the information, I've got all the information, good, bad, and otherwise, warts and all, based on that particular point of time, that also includes all the other medicines and treatment patterns that they may be on. So all I do now is that I ask people that they don't add anything new, right?
That's fair.
That doesn't mean to say that they're going to follow that advice.
That's true. They still...
But I ask them not to. And the reason... And I don't take people off things, because you can get a whole range of symptoms by going off medications. Right? I mean, if someone gave up coffee and the next time that I see them, they've been complaining about headaches for the last couple of weeks, I would think that perhaps the remedy was wrong. But in fact, the fact that they've decided to give up coffee after 50 years of coffee drinking could be a major contributor as to why they're suddenly getting headaches.
And there's also, too, a lot to do with meds. Like, we know how many people take meds. It's incredibly common, and most people don't like it, but maybe they need to be on them. Their doctors suggest it. Look, that's not up to us to judge. We're here to find a homeopathic remedy for them. And it's not safe to just withdraw from any medicines, like, rapidly. And some people just don't understand this, and it's so much easier and more safe to just stay where you are and then add the remedy. So you see changes, don't you? It's not like the remedy doesn't work.
No, I definitely see the changes. And it's not about judging people, but I need to make a judgment. And in order to make a judgment, I need all factors to be as similar when there is a follow-up as possible to when I took the original case.
The best control that you can possibly have.
And that way, if you don't add anything...
Here's the plots enough.
That was my phone there. Sorry about that. There are two things going off. That stupid Siri, and also to our dog that you might hear in the background. It's night time and he's chasing rabbits and all sorts of things.
He's having a good time.
Yeah, he's having a good time. So where was I? I've got to make a judgment. So the best way to make a judgment is to make sure that there is a stability when it comes to environmental factors.
And pre-remedy, post-remedy,
pre-remedy, post-remedy. So that's why I say don't add anything new, but don't come off anything either, because that way I might not be able to tell because if one of these medicines is a contributing factor and now suddenly you come off it, I can either A, not think my remedy's doing something because you're getting additional symptoms because you're off this remedy, off this medication, or B, I can be patting myself on the back because this medicine was contributing to negative behaviour in some way. So by stopping it, that alleviates the negative behaviour and I'm going to think it's me.
Yeah.
And I don't want to be wrong either in the positive or the negative. So if you can keep as many factors going from point A to point B, then anything that happens in between, if I am the only change to the routine,
the remedy,
then I can make sure, then I can start to attribute that it's most likely going to be the remedy I've chosen.
And there's also other things, core parts of the case that you can see being influenced. Behaviours, just taking some antiparasitical or some whatever antibiotics, yes, might change some other aspects, some physical things. And it's true, if you can lower inflammation, you do get better behaviours. But there's often profound things that haven't been seen before. Even the practitioner can say, have you seen this before when they were taking this med? And the parent often will say, no, this is new, this is better, I haven't seen this, or haven't seen this for a long time. So there's behaviours, there's energy, there's not being as anxious, there's wanting to take on new tasks, there's the ability to go to sleep without having an adult right next to them. There's lots of things, better sleep, better quality sleep. You just don't get a broad range of improvements like that without things as deep and energetic as homeopathy.
No, the constitutional is what we're after, and the constitutional is always measured by how many conditions are ameliorated all at the one time.
Or in a sort of a sequence. Sometimes you might say there's 7 problems and you'll start to see 3 start to move, and then given time, number 4, 5 and 6.
What I mean by what I just said, though, about all these different things, these different conditions all being ameliorated, I'm not saying that they'll be ameliorated all at the same time. But what I am saying is that it starts addressing these different symptoms all at the same time. Right? They're not cured or alleviated at the same time to the same degree, but they all are touched in some way, right? Some positive way. Now, if you're having antibiotics and so on, or you're having steroids or whatever it might be, whatever is the drug that's necessary or you think is necessary, they can sort of influence behaviour in the sense that it can, if you're in a lot of pain or, if you're in a highly inflammatory state, it can bring you from the brink of that. So it's a little, it can sort of dull it, but it's different. When the right constitutional is there, people that are affected by that constitutional medicine are more engaging of the world. They want to embrace the world. It's not just being out of pain. It's about being out of pain and now wanting to embrace the world or the life that you think should be coming your way. And I have always, as I've spoken to you a few times, I always try and include how engaging people are. Now, I understand that there's different personality types and some people are shy and whatever, but there is a difference. If you're in the middle of an inflammatory flare and your brain is just not your friend, you're wanting to lock yourself away, all of the talk that when you do bother to talk seems to be about trying to reassure that your fears are unfounded, or that, if you even extend beyond the reassurance of your fears, it's just really a question that's usually about some base need being met.
I think you mentioned something in a previous conversation earlier today, and we were trying to reinvigorate that because we weren't recording, and it was quite interesting. But it reminds me now that you were saying how when someone's in a really bad place, their conversation is often consistently about their base needs. They can't really think outside themselves, and in fact that's a sign of health when someone starts to display a level of empathy towards other people's issues, not just their own.
Absolutely. So when you look at a conversation of a sick person in 1,000 different ways, but essentially there's three things going on. Me, and me. Right? What are you going to do for me? What's going to happen to me? Am I going to be all right? You know, and it can sometimes be, you know, very, very insular. Sometimes it can be grand, like what's going to happen to the world. And you think, okay, well, they're thinking outside of themselves. But then in the end, you realise, no, they're not. They're still talking about their own safety here. What happens to me if this world changes or whatever? So if you can narrow the conversation from three primary figures to two, you're going really well. And what I mean by that is that if you give a remedy and the conversation switches from me, and me to you and me, now we're getting somewhere, because it's embracing the world. You're coming out of yourself. The more landlocked into yourself, the bigger the sign of the sickness that's going on. When you get, you know, this sort of archetypical idea you have of the elderly person. There used to be a joke going around where I'm so old that my little black book is full of doctors' phone numbers, right?
Yeah.
Where it used to be full of girlfriends' numbers, and now it's just full of doctors' numbers. But that's how it gets. It gets into what is everyone going to do for me? Mm-hmm. And it's a serious sign of sickness. Now, you could then sort of be extensive of that, and so, but what happens when you have a culture where you're taking pictures of yourself and you're taking pictures of every plate of food that you're going to stick into that hole under your nose, thinking that it's of savage interest to everybody else, then, yeah, you've got every right to question the health of society, because it is me, and me.
Yeah.
But it's there's enough people in society that is still you and me, and the we part
Perhaps
of it.
they're the ones keeping it all going.
Oh, they generally are. The self-centred rarely make great strides in society. They take from society, but they rarely make great strides.
It's interesting, though, that the conversation's gone down this avenue, because it makes me think of there was always this sort of classic patient description of somebody who might get a serious autoimmune illness. And one of the reasons was because they're over-caring for others, that they're almost, you know, ignoring their own needs. So how does that fit into that idea of me, and me?
Oh, you have to be really tricky. No, I mean, that's really tricky. You have to be really careful here, because it's with a topic like this where the truth can be really offensive. There are two things going on with people who are just all giving to all people and yet get cancer and die at 42 or whatever it is. There are a couple of answers there. And again, this can be offensive to people, because everyone knows people that have been like this, and then, you know, someone like me comes along and it sounds like I'm knocking that beautiful person, and I'm not trying to. I'm just trying to understand the psychology of what got them into a mess, what got them into that mess.
Well, it's clearly a mess, because
it clearly is a mess
result.
because they died. Right?
Yeah, and it's tragic. It's terrible.
It is a tragedy, and there are two things. One, that they're not self-protective enough, and so what does that tell you? It tells you, you know, when we were just talking a moment ago, and we said that health is about when the way that you look at the world is you and me, but there's still a me in there.
Yeah. Yeah.
Okay.
Good point.
It's not
the balance
It's not
point.
about what can I do for you, and can I do any more, and can I sacrifice myself for everything. There's still got to be that boundary of me in there.
Well, that's not offensive. I think that's just balance.
Well, I hope it's not,
No, I
but the
don't think
next
so.
one might be a little more offensive.
Okay. All right. I'll let you go.
Because people are getting their self-esteem from giving.
Yeah.
And they need to be surrounded by people who they don't think may love them or appreciate them unless they are giving them stuff.
Okay.
And now they're giving away everything, including their energy.
Right.
Okay. And I don't mean to, so it's coming from a place of they're not strong enough in self.
So is that a space that you go into in a case where you examine low self-esteem? Is that linked in any way to remedy choice or not? It's not a remedy. Obviously, anybody and any remedy can have low self-esteem, but do you use low self-esteem to explore any aspect of the case?
Where I would go is that I would definitely try to find the aspects in their lifestyle that's draining them of their energy. So, and here again, you have to be really careful, because you don't want to sort of imply that a loving mum, friend, partner, etc., is giving away their energy when they really shouldn't be, because all their friends and family can still be uppermost in their mind. And so, but there's something wrong with overgiving.
Yeah.
Self-sacrifice is not, it's just not a good thing. We're not, first of all, we're not here for it. That's not what we're here for.
What about the mother-child relationship where, you know, when you give birth to a child and you have to literally feed them from your own body, you know, you're really giving a lot of yourself.
Yeah.
How does that tie in?
But now what do you do? Do you still smoke cigarettes? Do you still drink alcohol? Do you eat junk food to abandon when you're doing that? No. What you say is you say, I've got to look after myself because I've got to look after my child. So all of a sudden there's a you and me.
And also the getting back is clear in the love of the child, right?
Yes,
like,
you're
that's
getting
a huge
something
thing.
back.
Yeah.
Now this mum is looking down at this little face that's looking up and saying, I will do anything for you.
Yeah.
Right? And so that's a two-way street. If it's a one-way street and, you know, you don't want to complain, you're just giving until eventually you're just all given out.
And then what
not
happens,
good.
you know, the child gets older, things happen, and all of a sudden now they've got a diagnosis and now they're being really difficult, really selfish. It's all me, and the mother's exhausted. You know, that it's like the balance point's tipped over.
Yeah, and I often, even though the mum's not a patient, I'll often ask, and I'll often make suggestions that perhaps that they should make. And I know in this non-binary world that it's, you know, it's just, you're not meant to sort of talk about anything to do with gender roles and all this kind of stuff. But, you know, honestly, I'm too old for the modern world. It's, you know.
You're an old-fashioned guy.
Look, to me, it's just truths or not truths. And that gender has nothing to do with it. And one of the truths is that the mum is still the half of the home. And if she goes down, nearly everything goes down. And so when I think a mum is really stressed, I will offer a little bit of compassionate listening, and if she's open, I'll offer a little bit of advice. If she's sick and I think I might know what the remedy is, I might suggest even that. But
And you just opened a whole door there of, intuitive remedy choice. Like, how are you thinking you even know the remedy?
Oh, because if I think that this woman, I shouldn't say girl, should I? This woman is struggling.
Yeah.
I might look like I'm listening to the story, but in fact, I'm now starting to do a facial analysis,
oh, right.
and I'm working it out as best as I possibly can.
Yeah.
Now that might not be accurate, but I will do the best that I can.
And then a few keynotes and.
Yeah,
you choose
I don't
something.
suggest that she becomes a patient because I don't know. It's sort of I often feel like it feels like touting.
I was going to say
to me,
touting for business. You've never done that
seems
ever,
cheap, and I don't want that.
No.
I've never gone out and done that ever in my 35 years. I've never touted for business. We don't even advertise.
No.
So I mean, I've never done that, but at the same time, I can't let somebody whose role within a family diminish if there's something that I might be able to add.
Yeah.
So I might just sort of tweak, ask about their diet, tweak about that for a minute, or I might just sort of, are you doing anything to relax? Are you doing anything to get away? Are you doing, all those things? Because if they're not doing something for themselves, just like the beginning of this conversation, this is where people get themselves into trouble.
They burn out.
Right? You cannot do all give. No matter how much you love that child, no matter how much, you've got to still turn around, a bit like the aeroplanes, put your own mask on first.
Yeah.
And then put it on your child or put it on your loved one sitting next to you. You've got to be able to be strong enough to be able to help people, and you can't do that by collapsing.
Yeah, it's a fine line, and to deal with, the baby needs you 24/7, hopefully not 24/7, but, you've got to be available. But then as time goes on, if things are going well, the baby's relaxed enough and you're managing well and you get a bit organised, you can definitely get them to sleep and so on and so forth, and the breaks start to come.
Some babies are 24/7.
I know, and I
always remember a case quite, and I remember this because I got it. We got it.
Okay, tell us
straight away.
Tell me.
The case was that this kid would not stop screaming.
Oh, wow.
Constantly. And they had been everywhere. Royal Children's, the whole thing, the whole kit and caboodle. By the time they came to see me, this kid was probably about 18 months.
Right.
And they were at a state where every second day, the opposite partner would drive to Albury and back, and they lived in Melbourne.
Which, for everybody who's not in Victoria, is about
4 hours away.
From Melbourne, 4-hour drive each way.
Yeah, that's because the other one every second night could get 8 hours sleep.
Right.
Because this kid didn't sleep, hardly napped, and it just screamed and screamed and screamed. I wasn't doing HFA then. And I don't know why I chose cifalinum, but I did.
Yeah.
And it stopped straight away.
Wow.
Almost straight away.
Yeah.
Miracle. So, it is. It's amazing. So when you say, kid can't sort of be on your case 24/7.
No, I don't mean it like that. I mean that it's not desirable. I meant that if the child's balanced and relatively healthy and you're kind of got some good guidelines, but you're a very nurturing parent, you generally see children start to sleep reasonably well within it varies. You can have it at a couple of weeks if you're lucky, or it might be a few months. It's not about being selfish.
This is the thing. I think some mums think that any sort of self-care is selfish. It's not selfish, it's
No,
smart.
It's smart, absolutely. You don't want to be doing only self-care, obviously, but it's about that nice balance.
But that's just as sick, because now you're back into the me, and me.
No, it's all the balance, always about balance. But I was going to say it's an interesting thing because you start with this child and hopefully they're sleeping, not like the syphilinum child, but, you're getting some balance there in terms of when you nurture them and when you have a break, et cetera, and the years go by and then all of a sudden, that little cute toddler's a young child, and then they're going to school, and then they're pre-teens, and then they're a teenager, and then the dynamic can completely change because now teenagers can be quite selfish, not all of them, but some of them. And, part of it's finding their own way. They're not even necessarily all that sick, although a good remedy does seem to tone them down a bit. But it's an interesting break then, isn't it, when you get that balance between how much do you keep giving. And we see parents that just keep giving as if the child's 6 or 12 months old, which is not appropriate when they're 12 or 13 or 14. Like, it's a really hard balance to get right, isn't it?
It is. And you've got to understand too that the teenage brain's designed to be annoying. It is.
They're trying to separate.
They are trying to separate, and they're trying. You can't strike out with your independence and be similar at the same time. So they're going to push points of difference.
Yeah.
So they're really annoying for that. And the reason that they got to push that point of difference is that they've got to be able to leave home, and you've got to want them to leave home.
Yeah.
Because if they don't, they won't ever do it, and especially if they're boys, because boys are only as mature as circumstances demand. Right? Girls will turn into women on their own, but boys don't turn into men unless there's a woman or a circumstance that demands that they be a man.
Yeah. It's a difference,
it's a truth. I mean, that's a truth. And so a man will stay a boy for as long as they need to.
Yeah.
So you need to be able to push these kids out of the nest. If you don't, they'll stay in that nest, and you're not helping them, by the way.
It's a tricky thing, isn't it? But still, good remedy equals better outcome. Any way you look at it, and going back to the original question from the other homeopath, and nearly everybody's on different treatments. It's so common now that you don't need to fuss too much about it. Just as you said, keep it the same. Look for the remedy. Look for signs that it's working. If you look hard enough, you'll know whether it's working, and be honest with yourself as a practitioner too. Like, don't pretend it's working when it's not, but also don't allow a couple of things not going quite as well to turn your attention away from the 8 out of 10 things that are going okay.
But just taking a sidestep from the very lenient version, I would prefer that the cleaner the case, the easier it is for me to work. Not only that, the cleaner the case, the more respondent the patient.
Often, you do see that for sure. But here's that in between phase too. When the patient gets the confidence that the remedy is helping them, they can then go and step into the zone of discussing with the practitioner that prescribed whatever they're on, which isn't us. They can say, look, my symptoms are different. Can I start withdrawing this? And they can do it safely, under supervision. And a lot of people do, and they get to a point where they're not on those things anymore, and then they're even better. So, I mean, there's definitely a case for it, but it's a place you work towards carefully. I guess that's the message.
Yeah, that's true. And you also have to be accommodating for what you accept as the final outcome, because sometimes I can do it all, and then people will wean themselves off all medication, and all that's left is the homeopathic, and that's what is keeping somebody in their nice place. Sometimes it is myself and maybe 1, even 2 other medications to keep the whole thing going. Depends on the starting place. You know, I mean, the whole idea of pandas is it's a very broad net now. But when pandas was really first out, or my idea of what pandas is about, it is an otherwise neurotypical child that has an infection or some other type of internally inflammatory infection, and from that point their behaviour changes. And then my role is to get them back into that neurotypical state. But pandas is also being diagnosed in people who are, you know, severely autistic, really mentally disturbed, all sorts of things. Now, I'm not saying that the homeopathics can't work, but like Hahnemann wrote, even in his own writings, you know, I think it was about one of the remedies, it might have been veratrum, I think, is that it becomes increasingly difficult and you know it's going to be difficult because in the sphere that the vital force, and for those that are not homeopaths, the vital force is a term that was originally coined by Hahnemann, and essentially what it means is that it means the animating feature of being alive. So there's this kind of energetic force that we just call nature. You know, cells know how to reproduce, and there's information within the cell. But Hahnemann called all of that stabilizing, innovating energy under the banner of vital force. But also more than that, there was also a survival instinct linked to it. And that was also part of the vital force. And I've lost track now.
Yeah, you were mentioning veratrum and you were mentioning...
okay. So he's talking about you can tell the strength of the vital force by the sphere of which the disease is of greatest influence. So what I mean by that is that if you're talking about the physical body and there are a couple of leg ulcers versus somebody who's got a bit of indigestion, then you would say that the vital force of that person who's got the dark legs and the leg ulcers is weaker than the one that has got a bit of indigestion, right?
Mm-hmm. Weaker because the pathology's really got away from them.
Because the pathology's deeper.
Yep.
But now what you've got is that deeper emotional pathology is deeper again than deep physical pathology, and deep mental pathology is deeper again from deep emotional pathology, which is deeper than the deep physical pathology. So when you're starting to get, you know, to treat people who are completely delusional, they think they're God, or they think that they're going to be able to transcend into the eighth dimension, and you know, all responsibility for human life is on them. There'll be a few patients of mine that are listening to this that'll think, oh, that's my daughter or that's my son that they're talking about. But it's not. This is just generalized, because I can name you probably 10 kids off the top of my head that think that they're God, right? Or that God has made them, put them in a special place. Or it could be the opposite. It could be that the devil himself is torturing them, that they feel a responsibility, or that there's, you know, that the world will come to an end if they don't act as the saviour, or perhaps that I'm demonic, you know. But that complete break with reality shows you the depth of that pathology.
Yeah.
Right. So it's a sort of a Hering's law, but you're just including the mentals as the prime aspect.
Yeah, because it's the deepest part.
Because it's the deepest part.
And more challenging.
If you've ever been to a dementia ward, that dementia patient might be in good physical health, but they're not even there.
Yeah.
Right. The you that you used to know and love, which is why you're visiting them, out of respect for what they used to be is now no longer present. And it makes no difference whether or not they're in good physical health. If you lose that, you lose everything. And that's what Hahnemann's trying to say when he talks about these depths.
Yeah. No, that makes total sense. And, and this is probably why in many ways the mind's always been focused on as being the deepest part. But it's what you're saying, it's the deepest part of, if it's presenting as pathology, then it's important, its depth. But generally speaking, we don't have to delve into the mind to find the depth of the case. It's a completely different conversation.
You have someone who comes to me with, leg ulcers and, all this sort of stuff. Can you do anything for me? Well, providing I get the remedy quickly, which we usually do, thank you, HFA, and you're willing to make a couple of dietary and lifestyle changes because you won't have got here on your own, then, yeah, definitely. I mean, we've seen firsthand people whose, whole pancreas was shutting down and they were close to death and have just completely reversed it with just some remedies and lifestyle changes. Right, completely reversed it. So when it's on this physical, could I do anything for that person? Yeah, absolutely I can, providing you play the game with me, right? Because the remedy can't do it all, because that's called obstacles to cure. If you're got a whole lot of leg ulcers and your legs turning dark and you're a heavy smoker and you're living off chocolate donuts and your blood sugar levels are sky high, we're going to need a talk. And if you don't want to do the talk, just give me the remedy, well, then you have to expect that my impact is going to be limited. But if you're willing to make the changes that need to be made with a remedy, then yes, we can do it. But if you're going to come to me and say, my son is completely convinced that he's Jesus, such to the point, and I'm not joking, that they are putting the knives into the palms of their hands to create the wound holes to emulate it as proof to themselves and to anyone that's prepared to listen that they are Jesus. Can you do anything about that? Perhaps. But it's really going to be a long road because it's as deep as it gets.
And also, isn't it this idea that if sometimes you're in a really good balanced place, but then other times you're not. So you've got this spectrum of behaviour from really, really negative and aberrant and delusional through to almost normal, then what you're dealing there with is an energetic shift in the case. And if there's an energetic shift in the case from negative to positive, then the remedy can be introduced into the case to hold the patient in the positive zone, and the chances of them slipping back into the negative become less and less, or it's for a short period of time and then they're out of it again, or it just becomes less frequent. And so when there's no mental variability in the case, if it's very fixed 24/7, it's hard to use energy medicine to move it.
Yeah.
Harder.
Oh, very, very hard.
Yeah.
If you're getting variant, the less variance, the less chance.
Which is kind of what Hahnemann was saying too about the one-sided case. It's just stuck in one place. But if something's moving and it moves in and out of bad, even if it's in bad a lot of the time, I always like to, some of the cases are very challenging, and a question I like to ask just to get it into my own head is, what's the best day like? Tell me about a good day or a good hour or a good anything. And they're like, oh, it hardly ever happens. Doesn't matter. Tell me, does it happen? And if so, describe it. Then you know the potential to get back to that place and stay there exists because it's already occurred.
Yeah. But if they're struggling to come up, or they can only come up with a good hour, not a good day, let alone a good week, then you've got your work cut out for you.
It's challenging, but nonetheless,
because it's showing that it's showing that your vital force is not pliable.
Yeah.
And it's meant to be reactive to life, right? It's meant to be something that it's no longer a toing and froing, give and take animation. It's a rigid barrier.
Fixed, yeah.
Right. And if it's rigid, then the medicines find it difficult to move it.
Yeah, yeah. No, well, look, I don't know. I feel like we've covered all sorts of different topics, but, we're still speaking about, I guess, case management and the way you look at a case, and hopefully that's pretty interesting. I find it interesting, and I do it every clinical day, but I still really like hearing what you have to say, so thanks.
Oh, it's my pleasure. If anyone really wants anything specific, you can always write to us and we'll do what we can and to answer any questions. But it can't be anything. It can't be specific to you, though, right? I mean, my daughter's got a headache. What's a good remedy for it? No, we're not doing that kind of rubbish.
Well, you can't do it anyway.
If there's a topic that is,
of course.
then we're open.
Yep. Oh, good. Thanks, Grant.
All right. Okay. See you, everyone.
Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.